Hello, welcome to this video. In this video, I'm going to quickly go through all the written station in the new OSCE, which means the bowel assessments, oral care assessments, pressure area assessments, fluid balance, and nutrition assessments. And the first one I'm going to talk about is the bowel assessment. This station consists of two parts. The first part is that you will be given a photo of a stool sample and you have to correctly identify which type it belongs to, and then complete the form like this one. And then the next part is to produce a care plan according to the results in your part 1. It can either be diarrhea or constipation. If it's type 1 or type 2, then it means it's constipation, and if it's type 6 or 7, then it means it's diarrhea. And the main reason why people fail this station is because they are unable to correctly differentiate between diarrhea and constipation, and therefore produce an irrelevant care plan in the second part. So remember to pay attention to the photo so that you can get the correct diagnosis in this part. Then about the care plan, you have to identify at least 5 aspects in order to pass this skill station. And this is my method in remembering the care plan for both diarrhea and constipation, because these 6 areas are universal for both diagnoses. Just like for the first one, consider possible causes. So for constipation, you have to look for the causes. It can be because of the side effect of some medication, or it can be because of the diet habits of the patient, or sometimes it can be because the patient is immobile. And for diarrhea, of course, you have to look for the causes as well. So it can be food poisoning, or maybe some side effect of medication like antibiotics. And also it can be maybe the abnormal absorption problem, or maybe the patient has Crohn's disease or IBD. And for dietary advice, then of course called constipation, we will advise the patient to have a high fiber diet. But for diarrhea, we will usually advise the patient to have to reduce their fruits and vegetables, to reduce the fiber in their diet. But it's not about the OSCE exam, but if the patient got colonic cancer, so it means it's like a mechanical cause for the patient causing constipation. Actually, we won't advise the patient to have a high fiber diet. Actually, we have to advise them to have a low residue diet, because otherwise if you increase the fiber, it will just make the obstruction worse. But it's just for the case in colonic cancer patient, but it's not about the OSCE. And OSCE for constipation, for the care plan, you just put high fiber diet. Okay, so then I'll talk about the medication. Then for medication for diarrhea, we will, if it's not an infectious cause, then for diarrhea we will give patients some anti-motility medication like Imodium. And for constipation, then we will see maybe the person to see whether doctors prescribe the patient some laxative. And of course, for both of the case, we have to look for dehydration, because for constipation, dehydration is one of the possible causes. And of course, for patient with diarrhea, we have to look for dehydration, because the patient may lose lots of water. And of course, for both of them, we have to promote a positive toilet habit. And last but not least, we have to continue to assess the bowel pattern for both patients. Okay, so the next is the oral care plan. So in this station, you will be given a scenario and asked to produce a suitable care plan according to the scenario. So the 4 scenarios are ventilated patient, learning disability, or cancer patient, and the patient with dentures. And apart from that, you will be also given a form like this one, but it's usually pre-filled. And of course, I will still recommend you to check whether all details are really already filled for you, especially the total score. I mean, in your exam, it is also good, to be paid safe, right? Okay. So then is pressure area assessment. And this station also consists of 2 parts. In the first part, you will be given a scenario like this one. And then you have to calculate the breathing score for the patient. As you can see, so usually the scenario, they will use, some similar wordings with those definition of different parameters here. So actually, I think this station is not that difficult, but just I will recommend you to really read and be familiar with the breathing score, especially the definition of different parameters, so you can save some time for the next part. Because next part you have to identify at least 8 pressure area, and also have to answer at least 7 signs of pressure ulcer. But here so the pressure areas you put here, it need not to match with the scenario. Just like maybe actually in the scenario the patient is chair bound, but you can still put the back of head, or also put here. Okay, so next I'm going to talk about fluid balance. So in this station there will be a calculator provided, and so basically it's not that difficult. You only have to add the total input and total output, and then minus it, and then to find whether it's a positive or negative balance. So I'm going to just mention a few important things here. Just like for our food, if we start at 8 a.m. like this one, at a rate of 100 ml per hour, then put the 100 ml in the 9 a.m. box. Because if it starts at 8 a.m. at a rate of 100 ml per hour, then it means the patient will receive that 100 ml 1 hour later, right? Okay, so just like here, I put 100 ml, and then because I'm going only have to calculate from 8 a.m. to 7 p.m., so that's why I stopped at 7 p.m. Okay, so if the patient got like this one, to infusion, then I have to put it into different column. And then I'm going to talk about the drain. Unlike infusion, so basically if you insert a drain, then you will immediately got the output. So that's why like this one, if the pool drain inserted at 1400 and got 10 ml output, not hourly for 4 hours, so that's why I put 10 ml at 1400. Okay, and also for the negative or positive balance, I would recommend you to put the word positive or negative instead of just put a plus or minus sign here. Okay, and of course, remember to put the unit in this chart. Alright, and then okay, so now we move to nutritional assessments. So this station also consists of 2 parts as well. You will have to calculate the mass score for the patient and make a verbal report about what are you going to do for the patients according to the total score you calculated. So to calculate the mass score, you need the BMI of the patient, and then you also have to look for the percentage of the weight loss. And also you have to see whether the patient has some acute problem causing the patient may have some nutritional problem. And then finally you have to calculate the total score and to see whether the patient is at low risk, medium risk, or at high risk. Okay, so there will be no calculator in this station, but you don't have to calculate the BMI and also the percentage by yourself. So first of all, you will be given two tables like this one. Okay, so for the table on the right hand side is about the BMI score. So you will have to see the patient weight and also the height, and then to see which area does it fall into. So if it's fall into green, so it means it's 0, and if it's fall into yellow, then it means it's 1, and if it falls into the red zone, so it means the patient's score of the BMI is 2. And also for the percentage of the weight loss is the same. So first you have to see what the patient current weight, and then you have to see what the weight loss is, and then if it falls in the green, so it means 0. If it's in the yellow area, then it means 1, or if it's in the red area, then it means it's 2. Okay, and then finally you have to put all the score here like this, and just remember, don't put the BMI in the BMI score. You have to put the score instead of the numbers here. And then finally, calculate the total score for the patients. And then make a verbal report to the assessor according to your total score. Alright? And finally, thanks for watching, and I hope you like this video. If you have any questions or opinions, please feel free to leave us a comment under this video. Also, please subscribe to our channel if you want to know more OSCE information in the future. We hope to see you again in our next video. Thank you. Bye.